All right, now we're recording. Take it away.
All right, well, good morning, everyone. Thank you for joining us this morning while we present on Castro Valley Adult and Career Education's career education programs. So we are, if you didn't know this already, we're just a stone's throw away, right off of Seven Hills, off of Alma, really closely located to by the high school. So this morning we're going to talk about our medical academy and the classes that we offer within that program, and then also our wastewater operations. So we'll go ahead. I'm going to introduce myself. I'm Kerry Principato. I am the coordinator here at the school for our career ed programs. And then I'll go ahead and hand it over to Miss D. She is our lead medical academy instructor.
Good morning, everybody. My name is Elisa Dasalla. Most students just call me Miss D. I am going to talk to you about our medical academy and some of the courses and programs that we offer in our medical academy. So I am one of the teachers along with Ms. Sherman. You can see our beautiful picture here. And we have been teaching collectively at the adult school for quite a while, about 20 years experience. We are credentialed and we have both been in the field. So we come from the field with experience and we pass that on to students who can then, enter the field. Here is a student success story. We have many. We have students who graduate from our programs, go on to complete an externship after their in-class training, and oftentimes get offered jobs. This is Haral. She got offered a job at Kaiser, and she was also our Student of the Year. And she was honored by the Castro Valley Unified School District Board of Trustees. Great student, very motivated, and she did really well in the program. Here are some more rock star students. All of these students in the picture here have actually gone on, received jobs. A couple have gone on to other careers. Sheila, she's right next to me on the, let's see, on the left. She's actually in ophthalmology school right now. So she took our program, she worked in ophthalmology, and now she's going to be an ophthalmology tech. So there's lots of avenues that people take after they take our program. So it's, it's a stepping stone, or it can be, a professional career. Here are a lot of the medical facilities that have hired our students. So amongst them, Kaiser, Sutter, Stanford. You can see Bay Valley, Valley Care. We have a lot of clinics that hire our students. So here's the list here that you can see. It just depends what you're interested in. If you're interested in urgent care, if you're interested in working in your local community, you might want to do a local clinic. Some people want to work at Kaiser. So we partner with a lot of facilities. Okay, so the first program I'm going to talk about is our clinical medical assisting program. That's our largest program currently. It is 22 weeks. It is a hybrid program. So part of it is online, like all the lecture, most of the lectures online. And then we have a lab, on-campus lab day. So that lab day is usually a full day. And students learn tons of stuff. Okay, and I'm going to get into that a little bit. First, let me just talk about the schedule. Now, the cost here you see, it's just a rough idea, $22.75. Things change as years change, but it's approximately, that amount. We offer a prerequisite class. It's core skills. That means you take 4 sessions before you start the program. It's just to make sure that, you get some professional guidance. We help you with, how are you as a student? How are you as an employee? How do you get along with people? We play a lot of games. We work out different scenarios to see, what would you do in this situation? So core skills is a very valuable training, and we offer that before pretty much all of our programs. So for CMA, though, you will have to give up at least 2 days a week. Okay, that's that's going to be necessary. And depending on how much you need to study, then you'll give up some more time. We usually say, Mrs. Principato, we've been saying, what, 6 hours?
Yeah, probably about up to 6 to 8 hours a week, depending on your study habits.
Yeah. Okay, so the CMA program, as I said, you start with your core skills. And you learn, communication, how to self-manage, interpersonal skills. And it gives you a nice beginning to start the program. Once you complete core skills, then you go into our CMA program. It's 408 hours, and it gives you all the practical skills that you're going to need to work in a physician's office, or maybe even a clinic, some type of medical setting. Right now, we are, as I said, we are a hybrid program. So the first 9 weeks, you're online. And during those 9 weeks, we get you through medical terminology, anatomy and physiology. You learn all about medical law. You learn about HIPAA, which is all the privacy laws. And then once you have that solid foundation, we start going into the lab skills. So that means you're going to learn how to take vitals, right? Blood pressure, height, weight, pulse, all of those. You will learn how to collect specimens, administer injections, do an EKG. You'll learn how to chart. We do teach you how to draw blood, so venipuncture, and all of that is practiced in the lab. So, and students really enjoy that portion. They really love it. Okay, so as I was saying, we start off with medical terminology, anatomy, and physiology before you get on campus. We want you to understand the body. We want you to understand the terms. So when you get in lab, you feel more comfortable and you know what part of the body we're talking about, okay, when we're doing all these different lab skills. We also help you with career development. That means we're going to help you prepare a cover letter, a resume. We're going to make sure that you practice interviewing for a position. So that's all included. As well as all the clinical, we teach you administration. Okay, so we're going to teach you some basics of how to, answer the phones correctly, and how to do some coding, medical coding, how to understand health insurance, because you're going to have to explain these things to patients. So we will give you information on that, and you will practice scenarios on how to greet a patient, how to answer the phone, how to make appointments. All of that will be part of your program. Once you complete the program, you can sit for state certification or you can sit for national certification. And really the difference is, you're in California. So if you're in California, most states accept the California certification. So most students just do the California certification. I personally like the state certification, California certification, because you have 5 years. So once you get certified, you're certified for 5 years. And in those 5 years, if your employer says, hey, you want to do a workshop? Yes, please. Hey, do you want to do a class? Yes, please. You just go to everything you can because you want to learn and grow in your field. And then in 5 years, you just submit that documentation, and that turns into continuing education units. With a national, you have to recertify every 2 years. So for me, personally, I like the every 5 years, but if you really want national certification, that's awesome. There's no difference in the testing. They have to test you on the same things. So testing, it doesn't change that. Okay, the only difference is how often you need to recertify. Okay, so that was a clinical medical assistant program, becoming a CMA. This is our new program. It's community health worker with Health Navigator program. And this is a huge growing field. This field is great for people who love people. And it's also important that you love people when you're a CMA too. But you're working directly in communities with individuals. It can range from helping them with their health care, helping them with their appointments, you know, going in and seeing what resources you can give them. It's social worker 1, I would say. So it's like, you know, helping people navigate the system. Social workers are very busy, right? They're hugely in demand, and community health workers are kind of like the entry level step to that in a way, because they can assist with the social work, and they can assist in healthcare, they can assist in housing, they can assist in rehabilitation, re-entry, which, you know, a lot of people want to work with individuals in their communities. So there's a lot of growth in this area. I think the best thing to think about when you think about community health worker is this is a job for somebody who really wants to connect with people and wants to connect in the community. So, you know, that's what I like to say about it. The health navigation part is an extra part of it that we've added in, because we think that, you know, being able to understand the health component is really important. When people get out of prison, they haven't had good health care. They don't know how to navigate the system. Okay, so they need help. People who their first language isn't English will need translators, and they need to have their healthcare information translated to them. They need to know where they're going to go, what are their choices, what are their resources. So that's part of the reason that the Health Navigator is added into this, to help individuals who are kind of lost, you know, lost in the loop for that. We do have an orientation for all of our programs. So if you're interested, you know, you can contact us. We'll tell you when the next orientation is. As I said before, we always have core skills before, because core skills really prepares you to be a student, and it prepares you to be an employee. And it also helps with your confidence. So we do that with every program. And then we go right into our hybrid program. Again, very similar. A lot of the lectures online. We do come on campus for a few sessions. And as you can see there, there's the price, the current price. But again, you know, that's kind of morphing and changing as we go along. Okay, so I've talked about the orientation. Okay, if you're interested in any of our programs, the best thing to do is to call us, and we will give you that information. And you will speak to Miss Leanne or Mrs. Principato about when the next orientation will be. Core skills, kind of discussed that already. But right here at the bottom, it talks a little bit more about what CHWs and Health Navigator, what the roles are, okay? You work in public health. So you're dealing with individuals who need resources, right? Public. It could be affordable housing. It could be benefit programs like SSI, CalFresh, IHSS, EBT. You could coordinate their care, making sure that the individual gets the care they need, talking to one physician and then maybe talking to another, making sure that they're talking and everybody's on the same page for this patient or this individual. Transition support, so transitioning from, you know, a skilled nursing facility to home, transitioning from being released from a facility, prison, to, you know, housing. Recovery support, so helping people who have addictions, making sure that you know how to document, super important. We teach you all that. Making sure you know how to coach people on how to stay healthy, how to take care of themselves, what options they have, what are their resources. Health literacy, helping to understand what their condition is about. You know, we have a lot of people diagnosed with diabetes that really don't understand it. And being able to explain that to somebody and help them design a food plan on how they're going to eat, helping them design an exercise or walking program, you know, all of that stuff you can help them with. And then of course, career development. We always offer career development to help the individual, the student, right, create a cover letter and a resume. Okay. All right, so what are the requirements? How deep do we want to get into the woods here?
Misty, yeah, I think we can probably cruise right through this.
Okay.
The only requirement I think that students might need to know right now is that in order to join any of these programs, you do need to be at least 18 years old.
Okay. Do we want to talk about this?
A little bit about the externship.
Yeah. So that what I like to say about career programs is that for me personally, I can tell you my personal experience is when I got out of high school, I did not know what I wanted to do. I wasn't sure where my fit was. So I went to Chabot and I took just by fluke, I signed up for a medical terminology class. And that really got me interested because I was like, this is kind of cool. Like I'm learning another language and it's really interesting. So that kind of got me into medical assisting. So then I decided to go into the medical assisting program. And it has been very rewarding for me in many ways because I have been able to take that information and use it all throughout my life, not only in my personal life, but my professional life. In the program, you will have an opportunity to go ahead and complete your coursework. And then if you want to, you can do an externship, okay? And this is for both programs. Now the externship, and a lot of students are like, is externship the same as internship? Externship is you're all done with your classwork. And now you're gonna go in the field and you're going to shadow and possibly do some of your skills depending on the facility. And you're going to get to practice and you're going to get to learn real time, right? So it's valuable. It's a valuable experience and you want that. I did that with my my program, and that was a long time ago, as you can tell by the color of my hair. So, and it was very beneficial. I did some time at Kaiser and I went to a private office and it helped build my confidence. People showed me what to do. They were kind. They took me under their wing. And it was a great experience. And it was a stepping stone for so many other things that I did. So, you know, if you consider the program, you may want to consider an externship also. You do have to have a certain grade to qualify for an externship. You have to also make sure not to have too many absences. But we discuss attendance and how important it is in core skills and throughout the program. So we're your biggest cheerleaders and your biggest motivators. That's our job as teachers. Okay. We also offer medical terminology and anatomy and physiology. We do it as a short course. 6 weeks is usually around the time frame for that class. It's a great class because it introduces you to the language of medicine and the body so that you feel more comfortable once you get into the medical programs. And this is online, completely online. We also have an online administrative medical assisting course. This is really great for people who don't want to deal with fluids, if you will, you know, blood, sticking people. Maybe that doesn't appeal to you, but yet, you know, sitting at the front desk, answering the phone, scheduling appointments, checking on insurance benefits, you know, just greeting the patients, that might be something that interests you. So that would be the administrative medical assistant. Again, you would learn medical terminology, all your anatomy. You'd learn tons of stuff. You just wouldn't do the lab skills. The lab skills are a little different in this part. You'd learn how to do medical coding and billing and working in the health record and how to chart. And you could also sit for certification and get your certification as an administrative medical assistant. But it's completely online. And it's usually 2 days a week. And you can see the current price there, $675.
All right, maybe we should go ahead and pause for questions. If there were any questions about the either medical program health that we just talked about.
Does anybody have any questions for Ms. D about medical program? Any questions so far?
Pretty much you have to be 18. So you have to be at least 18 and graduated high school.
Yes, so we do require, yes, for adult school programs, 18 years is definitely required, 18 and older. We do require a high school diploma or GED for medical assisting. For the community health worker program, that is not currently a requirement. So this would be something if you're thinking about, I don't know where you are in school, I'm thinking you're seniors, if I'm correct there. In what we've had in the past, we've had the CVHS students attend orientations, because the orientations are usually for the next start will be in late spring, early summer. So if you are, having a birthday, as long as you're 18 before the first day, before the program starts, then you are able to participate. You could definitely join an orientation and learn more about the program, and if you haven't turned 18 yet, that's okay. So our dates for the next medical programs orientation will be posted on our website January, February, and there'll be a virtual orientation held in late spring. For it'll be probably about late May that our next classes will start in late May. But if you're interested in, if you have a particular question, please don't hesitate to give us a call and we can help you out with those questions. All right, any other questions?
I also wanted to add that in California, because we have, it's really hard to get into nursing programs. It's very challenging now. We have many students who decide to do our program and they work, in medical while they're trying to apply for nursing school. And it's a positive because you now have this to put on your application for nursing school. You've been able to work in the field. You have kind of an edge because you know how to do injections and you know how to do a lot of the lab stuff. So we've had a lot of students who have become nurses after taking our program. So it is a very positive if you're thinking of that, as a nursing career somewhere down the line. This is a great entry to that as well. And even for paramedic, if you want to be an EMT, a paramedic, fire, this program is very good to have on your application.
If I can just add to that, yeah, you'd actually get an extra point on your nursing school application if you've done a program and then have worked in the field. Also, we have students that have taken this program that have become physician's assistants. So one Castro Valley High School graduate, he actually comes and talks to our students regularly. He it was a few years ago, but he's been a PA for several years now. Like Ms. D said, lots of nurses, nutritionists, different pathways. So in the course of the program, you'll learn about different specialties, and it can really pique your interest on what your career path would look like. But again, very low cost, considering private schools are charging $20,000 plus. Student loans that you don't need to incur when you can get the exact same quality, even better, if I may say, right in your hometown with short-term commitment of time, 6 months, and relatively very low cost considering the cost of private schools. So, all right.
Wait,
Let me
before you go on. Brag about your award that you got, Ms. D. Tell us.
Really? We're gonna go there. I don't know if I want to do that. Maybe I don't know. I don't know.
Well, I can do it for you. I mean, of course, yeah. Let's do. So Misty was nominated for Alameda County's for the school district, Castro Valley Unified School District Teacher of the Year. So anyone that's taken her course, she has quite a fan club. She is great instructor, fun, really brings points home so students get it. You get the information many ways. So depending on your learning style, you're going to be able to learn the material and enjoy while you're learning and laugh a little bit, which is always important. So both Miss Sherman and Miss D make class really fun, and you'll learn. We get so many, great compliments about them, each cohort. And it's important that you have a good connection with your teachers. They have both worked in the field. Misty has a master's degree in counseling. Counseling? Yeah, but she will say that all of the jobs that she's ever had have been from, I can't talk, come from her medical assistant training. So definitely, worth checking out. It's a great program. And like she was saying earlier, the community health worker is a huge really new evolving job that is lots of jobs out there. Average pay is about $22 an hour. So something to do while maybe you are going to school part-time, working part-time. But if you're interested in healthcare, social work, these are great first steps.
Absolutely, absolutely. And just really quick, when I did my medical assisting, I was able to get employment, and then I went on to get my BA in social work. And then I was working as a community health worker so I could get my master's degree. So both of these actually are right up my alley, and they have been so beneficial. Not only have I learned how to work with lots of people and to help people, it's just been very rewarding. Like, you feel this is a career. I always tell the students, you're not getting a job. You're going to be a career professional. So, and for the amount of money of these programs, it is well worth it. It is well worth it. But don't pay $20,000 for this. Don't do that. It's right here for you.
Absolutely. All right, let's shift gears and talk about wastewater operations hybrid program. So essentially, I'm going to go ahead and minimize this so I can, and sorry about moving our heads around so much. I don't know what it looks like on your side, but all right, let me minimize this. So it's still public health, right? You think about our water and keeping it clean and safe and making sure the waste goes in the proper, down the proper pathway and to the, to be cleaned and treated before it's dumped into the bay. Huge public safety, public health there. So we offer a wonderful wastewater operations program. The program is taught by two people that are in the industry. One of the instructors is a manager. He manages at a plant. And the other instructor, she worked as an operator but she also has an MBA. So she has the whole financial background. So not only does she have the ground floor operations knowledge, she also leveraged her MBA to now work in the financial and accounting part of an agency that she works for. So you'll learn so much about the systems and how to treat wastewater. People that have an interest in environmental sciences will definitely enjoy this. You're dealing with live organic matter and you are controlling it to make sure that it's treated properly before the wastewater is dumped into our bay, our beautiful bay, trying to keep that clean and safe for all of the wildlife as well as our own safety. So this program is on Wednesday evenings. Currently it's hybrid. We use Canvas as our learning management system, and we use that in the medical as well. So you will have live virtual lectures with your teachers and your fellow students, and you will learn everything that you need to sit for the state exam, okay, to get your level 1, level 2 license to be able to work in a plant. So you also, this is a program through Sacramento State. And so you get 18 continuing education units once you complete this program. So the benefits of working in this career field are the great pay, excellent pay and benefits. So the average salary right now is about $34 an hour. And that is taken from our Employment Development Department labor market information. But again, I would encourage you, we run it once a year. It's about a 9-month program. And the next time we run it will be in the fall. And the orientation will be in May or June. So you'll just take a math assessment. There is a little bit of math involved, but the teachers do a great job. It's formula based of teaching you, how to work the formulas. So not to be intimidated by that. But I would encourage you to participate in orientation and see if it's the right career path for you. We have so many success stories from this program. San Leandro, the city of San Leandro alone has about 4 or 5 of our students working there as operators, and one had a biological sciences background, so he's working in the lab. But you could work for a small plant, say Coca-Cola, for example. They produce wastewater, and that wastewater needs to be treated before it's released. Hospitals, they have small wastewater that they need to treat as well. And then also, of course, the big city plants. So lots of different flexibility within this profession as well. And again, I can't speak highly enough. It's a great program that has afforded a great career for many of our students. Unfortunately, I'm not the instructor, so I don't have a lot of the nitty-gritty details, but should you have any questions, I will do my best to answer them or get you the answers.
All right, so does anybody have any questions for Ms. Principato about the wastewater treatment program? Interested in learning more? We'll have all the information that's on here also sent to you guys as you signed up to teach more. You'll have that information with you. And we'll also be posting this presentation on our website. So if you want to go back and look through the presentation, if there's any slide information that you might have missed that you want to take a closer look at, that'll be available to you as well. So do you guys have anything more to add on your end?
Well, I definitely thank you all for your time and attention, and just keep in mind, doesn't have to, you don't have to go into debt to start a career path. And just make sure that, you want to make sure you can go into something without, like incurring lots of student loan debt as you're figuring out what you want to do. And that's why I think the adult school programs have some great options for you as a student exploring career paths. So please do check us out. And again, any questions, feel free to give us a call, send us an email, and we'll be happy to help you with those. Thank you so much.
Thank you.
Thank you so much for your time. Thank you.